Our lovely patient, who is 53 years old, comes in about a month after her facelift, upper eyelid surgery, and her rhinoplasty, and she's very graciously agreed to share some of her thoughts and feelings about how she's feeling.
Graciously, because I feel fantastic. I feel absolutely fantastic. And in fact, to be completely transparent, I was a little hesitant about doing 3 big surgeries at one time. And from the get-go in the first meeting with fabulous Dr. Clater, he made me feel very comfortable. The entire staff is incredible. So I just said, you know what, I'm just going to go for it. And I was so surprised at how smooth the process went. I mean, I know, the first night or two, obviously, you're a little uncomfortable. It's not going to be, feeling fabulous. But I was incredibly surprised at how quickly I started feeling good again. And the results are incredible. And I'm so thrilled. I'm beyond thrilled. And the best part about it, too, is even Dr. Clater himself, like from the first night where obviously you have questions when, you're feeling a little swollen or whatever, is reachable 24/7, gets back to you right away. You just feel completely comfortable through the whole process. I'm so glad I didn't overthink it, and which, I'm the type of person I overthink, I might back out of something. If you're thinking of doing this, do it. I never thought I'd feel as good as I feel, and I'm not even 4 weeks out. This was the best decision I've ever made. So,
You are so generous and so kind. What were some of the things that made you apprehensive before surgery?
Well, I think it is fear of surgery itself. I mean, I know I've had minor surgeries in the past where, the fear of anesthesia and how painful is this going to be, how uncomfortable. I mean, it was just not one surgery I was getting done at one time. I was just going for it and getting 3. So how extensive, how, on a 1 to 10, is this going to be a 20 of pain? And it really wasn't. I think the most uncomfortable thing for me, honestly, was the fact that I was nauseous after the anesthesia and had a sore throat from the tube. It really wasn't so bad. I was shocked by that. And even that's so minimal when I look back now, weeks later, with how happy I am with the results. I mean, I'm just so excited to just feel the way I've always wanted to feel, or look the way I feel, if that makes sense. Like, you look at pictures of yourself and you always pick apart yourself, but the things that you're insecure about or whatever, when you get to a certain age, I'm 53, going to be 54, and you want to feel a certain way, and to actually now look it is just amazing to me. So I could go on and on.
That's fabulous. That's fabulous. When you look at your neck, what are you seeing?
Okay, well, I'm going to not lie. I think I've taken like 150 pictures of my neck on my phone right now and sent them to like my friends and like, look at me. I got to the point where all I saw was my, the turkey waddle, the dreaded turkey waddle that, I felt like I hit 50 and then suddenly there it is. And it became all that I saw. And I would, see pictures of me from the profile, and it was just, was such a self-conscious thing. I didn't realize how self-conscious I was until now. I'm just excited to see the neck that I feel like I had when I was in my 30s, the profile I had when I was in my 30s. And that's just, it's incredible to feel that way. You feel so good on the inside and you want to feel as good on the outside. So yeah, it's amazing. I couldn't be more excited.
You are so fabulous. The one last question I always like to ask people, is this something you would recommend to a friend?
1,000%. 1,000%. If it's something you're thinking about, don't overthink it. Just do it. I mean, you have one life. Feel as good as you can feel and look as good as you can look. And this is the team that you want to be working with. And Dr. Clater is a doctor you want to go to. 1,000%. Don't hold back. Just go for it. I'm coming back. I'm not done.
You are so very kind. Thank you so much.